and good afternoon, ladies and gentlemen, distinguished chairperson, presenter, and participants. Welcome to the parallel workshop session in the International Conference on Media and Communication, MENTION 2021. I'm Natasha, and I'll be the MC for today. I will be assisted by Farhan Nasir in this parallel workshop session. This is session B1 with the theme Media and COVID-19. The chairperson for this session is Dr. Arina Anis Azlan. We have 3 paper presenters today, and each presenter is given 10 to 15 minutes of presentation time. If any of the presenter could not give a live presentation due to internet problems, we will play back their video, but we hope that the presenter is available for question and answer session later. Without further ado, over to you, Dr. Anis.
All right, thank you very much, Tasha, for your introduction. Assalamualaikum and good afternoon to all that are here today. So this is the session on media and COVID-19. First of all, allow me to introduce myself. My name is Dr. Arina Anis Azlan, a lecturer with MENTION, the Center for Research in Media and Communication at UKM. You may call me Anis. I am actually a specialist in, or my specialization is in health communication. So I am also the Deputy Director for the UKM UNICEF C4D Center here in UKM, or HealthCom. Today we have 3 presenters with us who will be presenting papers on media and COVID-19. And we will begin with our first presenter, if allow me to introduce, Dr. Aisah Mary from the Faculty of Social Science and Humanities, University of Malaysia, Sabah, with a paper entitled Halayak dan Media Semasa COVID-19, Perspektif Kegunaan dan Kepuasan Media di Sabah. So without further ado, I hand over the floor to you.
Okay, thank you so much, Dr. Anis. Okay, give me. Okay, can you see my slide just now?
Yep, we can see them.
Okay. So, okay. So, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Before I start my presentations, I would like to apologize to everyone in here because actually my research paper is in Bahasa Melayu. So my presentations also, I will be presenting in Bahasa Melayu, but if I have an extra times after these presentations, I will make a short explanations about this research. Okay, so basically this research is about audience and media during COVID-19 pandemic. So we are using users and gratification theory. This is from the users and gratification perspective. Okay, we want to study how people in Sabah engage with their the media activities during or while facing this COVID-19 pandemic. So me as a team leader and then with my other team members, Siti Nurbayu, Cyril Modili, and also Amrullah Maraning, we are from University Malaysia Sabah. So basically, as an introduction, sebagai pengenalannya, sebenarnya usaha ini adalah satu usaha untuk melihat bagaimanakah sebenarnya penggunaan media dalam kalangan masyarakat di Sabah ketika mereka berhadapan dengan this COVID-19 pandemic, dan sekarang ini mungkin sudah dikenali sebagai endemik kan. Jadi menjadikan laporan daripada SKMM atau Suruhanjaya Komunikasi dan Multimedia in 2020 itu sebagai satu benchmark sebenarnya, di mana this MCMC report that media usage among people in Malaysia during facing or while facing this COVID-19 pandemic is quite high. Compare tahun 2019 in 2020, the pattern of the media usage itu sangat-sangat meningkatlah, dan mungkin the main factor adalah MCO ataupun movement control order yang dilaksanakan pada ketika itu. Jadi di mana bila mana laporan ini sudah dikeluarkan oleh MCMC, dan kita di Malaysia of course we have ada different states dan sebagainya. Okay, kita ingin melihat bagaimanakah dengan corak penggunaan media di Sabah pula ketika this crisis happen, dan kita menggunakan this use and gratification theory as a theoretical framework to study this pattern of the media usage among especially people in Sabah itself. So when we talk about uses and gratification theory, teori ini merupakan satu teori yang agak lama sebenarnya, dan jika kita lihat kerangka teoretikalnya, this theoretical framework, ianya sudah digunakan sebagai, saya suka penggunaan analogi kacamata untuk melihat keadaan-keadaan bagaimana kita sebagai khalayak ini, aktiviti penggunaan khalayak kita. Dan sebelum ini, teori UNG ini juga sering digunakan sebagai satu theoretical framework untuk menganalisis atau melihat bagaimanakah khalayak menggunakan media, khususnya ketika krisis terjadi, di mana kajian-kajian yang lepas, okay, Maxwell misalnya, he studies about how media, how audience in I'm not remember the states in America, but during the tornado, if I'm not mistaken, how these people use this media to share the informations and so on. So kajian Tengku Aisyah during the banjir in 2015 di Peninsula Malaysia, dan kajian Wang 2020. Jadi kita ingin melihat menggunakan still uses and gratification theory ini sebagai satu kacamata untuk kita melihat bagaimanakah pula kepenggunaan ataupun bagaimana khalayak di Sabah itu menggunakan media, khususnya ketika krisis COVID-19 itu terjadi. So we have a three main objective in this research. The first one is we want to identify what are the needs that trigger or encourage these people menggunakan media, and then the second one is we want to identify what are the uses of media, okay, dalam penggunaan media dalam kalangan khalayak, especially in Sabah. And then the third objective is to identify the gratifications that obtained from the media usage activity. So it's very simple here, it's very clear. We want to identify three variables only. What are the needs, uses, and gratifications as well. So these are the kajian lepas or previous literature review. So saya ingin menyentuh sedikit tentang the media usage di dalam teori UNG itu sendiri, because kalau ikut Rubin, according to Rubin, UNG ini memang, teori UNG ini memang sering digunakan untuk to give you the clear picture bagaimana audience itu engage dengan dia media usage activities. So in this theory is very simple. Kita sebagai audience, okay, the main assumptions of this theory is we as an audience is very active, and we can use the same media, of course, to fulfill our different needs, uses, and gratifications. Okay, so this is according to Katz, Sergerio, Lee, and Emery in 2020. So maka di sinilah teori ini dijadikan sebagai kerangka teoretikal untuk melihat, untuk kita cuba untuk explore bagaimana dengan penggunaan media dalam kalangan khalayak, especially in Sabah ini. Okay, so we move to the methodologies part. Actually, this is a fully quantitative research. Okay, ini menggunakan kaedah tinjauan. Okay, melibatkan 828 respondents, and the age range is from 16 to 45 years old. Most of the respondents are from Kota Kinabalu, Kota Belud, Tawau, Sempurna, Lahad Datu, Beaufort, and Tuaran. This is fully online questionnaire. Kita distribute all the questionnaire in September 2020 until end of September 2020 as well. So hampir sebulan juga lah. Okay, so these are the findings from this research. Daripada ethnic respondents yang terlibat dalam penyelidikan ini, majority of the respondents are from Bajau, and then this is followed by Kadazan Dusun, Melayu, Muru, Cina, and others, because in Sabah, Sabah is one of the multiracials. We have a multiracial ethnic. We have more than 30 ethnics actually. So from the media usage during the pandemic, we asked the respondents what's the main media yang mereka gunakan ketika pandemic COVID-19 itu, ketika mereka berhadapan dengan this pandemic COVID-19 in 2020. So the most popular media yang digunakan oleh people in Sabah is social media, and then this is followed by news portal, and then barulah diikuti oleh television, radio, and newspaper as well. And we also ask our respondents, okay, daripada social media itu, apakah jenis-jenis social media yang sering mereka gunakan juga. So this is our findings. WhatsApp is the most popular social media among people in Sabah lah, and then this is followed by YouTube, Facebook, Instagram, and Twitter as well. So saya sengaja letakkan dapatan kajian ini menggunakan objektif-objektif, okay, di mana in my previous slide, my first objective is to identify what are the needs, keperluan itu yang mendorong, apakah keperluan yang mendorong masyarakat di Sabah ini untuk menggunakan media. So hasil dapatan kajian mendapati the cognitive needs is the most crucial parts lah, is the most crucial needs yang paling ketara, because mereka memerlukan maklumat, sentiasa ingin dimaklumkan tentang yes, during crisis memang kita semua perlukan apa-apa maklumat, of course, tentang isu-isu seperti vaksin dan sebagainya. Dan ini diikuti pula oleh keperluan-keperluan lain, iaitu seperti keperluan pelepasan diri, penyepadan sosial and effective needs. Okay, saya ringkaskan sahaja begitu. So untuk objektif yang kedua, iaitu tadi our second objective is to identify what are the uses of media itself. So jadi kita lihat di sini bahawa di information searching adalah salah satu kegunaan yang paling kritikal dalam kalangan masyarakat di Sabah. Okay, menambahkan ilmu pengetahuan tentang apa sahaja isu-isu COVID-19 itu, dan ini diikuti pula oleh kegunaan-kegunaan yang lain seperti habit, escapism dan juga information sharing. So ini information sharing hampir sama dapatan kajiannya dengan kajian oleh Tengku Aisyah during peristiwa banjir pada tahun 2015. So our third objective, which is we want to identify what are the gratifications that obtained from their media usage activities. So there are three types of gratifications yang terlibat, which is the first one is convenience. Okay, convenience ini kita boleh kaitkan dengan dapatan awal tadi, which is most of the respondents itu mengakses WhatsApp dan juga news portal menerusi mereka punya their own smartphone. So ini yang kita boleh kaitkan dengan kepuasan mudah, which is smartphones very easy to use, it's very easy to access. You can bring your handphone pergi ke mana saja kan. So then we can relate the findings itu dengan kepuasan mudah itu. Dan ini kita kaitkan dengan technology determinations nanti dalam perbincangan. So the second gratifications adalah from the interpersonal discussions perspektif dan juga surveillance itu sendiri, pengawasan tentang apa-apa sahaja isu. They need to be more peka tentang keadaan-keadaan yang berlaku di persekitaran mereka. So di bahagian kesimpulan kajian ini saya boleh merumuskan bahawa di media usage khalayak di Sabah while facing this COVID-19 situations is quite active lah, sama dengan apa yang dikeluarkan dapatan oleh laporan yang dikeluarkan oleh MCMC pada tahun 2020, di mana ia hampir menyamai pola penggunaan media dalam kalangan masyarakat di Malaysia is quite high. During this crisis kita boleh lihat dia punya laporan itu from 2019, 2018 and so on. So yang saya boleh kongsikan juga di mana media sosial itu merupakan bukan antara yang paling kerap digunakan oleh masyarakat di Sabah untuk mereka mengetahui tentang any issues of COVID-19 dan sebagainya, dan tidak dinafikan sebenarnya macam saya terangkan di bahagian kepuasan tadi, this determination technology itu is the main factor lah yang mempengaruhi bagaimana telefon pintar sebenarnya merupakan satu pendorong dalam trigger this kepuasan mudah. It is very easy to access and it's very easy to bring sebenarnya. So saya rasa itu sahaja untuk pembentangan saya, dan sedikit penghargaan. Actually this is a research grant is funded by Scheme Dana Khas COVID-19 from University Malaysia Sabah. Okay, so I think that's all from me. Okay, I will stop sharing my lecture. Thank you, Dr. Anis.
All right, thank you very much, Dr. Aisa, for sharing your research findings. We will leave the question and answers for the end of the session. But if you have any questions that you maybe want to jot down now, you can put them in the chat box, and we will. I'll refer to that later. For now, we will move on to our next presenter. I'll introduce Dr. Latif Lai, who is also from University Malaysia Sabah. He's leading the UMS UNICEF C4D Research Unit at the Faculty of Social Sciences, with the presentation on a study on knowledge, attitude, and behavior towards acceptance of the COVID-19 vaccine among the people of Sabah. The floor is yours, Dr. Latif.
Thank you, Dr. Anis. Yeah, I will trying to share my screen. Okay. Is my screen is visible on you?
Yep, we can see it.
Yeah, thank you very much. My presentation is very short. Okay. And then I would like to make an early disclaimer that this study is not very academic, because we did this to honor the request from Jabatan Kesihatan Negeri Sabah and the state government to help them to find out why or what are the level of acceptance among the peoples of Sabah about the COVID-19 vaccines, because as we all know, Sabah has registered and as well as having a very low percentage of people registered to get the vaccines early on. Okay, so that is the motivation. So the purpose of the study is one is to uncover the perceived knowledge, the attitude, and the behavior inclinations in relation to the acceptance of the COVID-19 vaccine, to identify if there are significant differences between their few demographic elements such as sexes, genders, and I think age, right? And then to find out the proportions of people who accept, refuse, and who are incisive about the COVID-19 vaccine. We do have the national data. Ministry of Health has conducted twice. I mean, once in December and the other one in April, if I'm not mistaken. But we still need to identify how the Sabah peoples will fare in comparison with the national survey. All right. So to do that, we conducted a survey. We targeted to get 1,000 respondents, but we only get about 985 respondents. 485 through online, and then 500 through face-to-face interview, and 3 major towns. We just focus on 3 major towns for the interview. Kota Kinabalu, Tawau, Sandakan, and we also included certain percentage of undocumented populations in Sabah. So we do the data collections throughout March 2021. All right, so these are the demographics in terms of group age. We can say that's quite fairly distributed. The biggest numbers is between the age of 18 to 23 years old. Okay, and then we have, I think, less than 0.12%, 70 years old. Okay, in terms of occupations, public sectors, private sectors, we do have 25% of them are students. Okay, housewife, some are unemployed, and educations and gross income group that we group based on the B40, M40, and T20. We have 35% no income. This basically referring to the students group as well as the unemployed and housewife. Okay. In terms of sex and citizenship status, we have 44% male, 58% females, 19% are non-citizen or the undocumented people in Sabah, and then 81% of our respondents are citizens. Right. So the first findings, we wanted to know the perceived knowledge, attitudes, and behaviors. In terms of knowledge, okay, The lowest score is how vaccines is developed. Okay, we just get the score of 3 out of 5. And then the contents of the vaccines, how vaccines work, benefit of vaccines, side effect of vaccines, vaccines to help in herd immunities, and availability of vaccines in Malaysia score highest because these are most of the message that has been played by government. Okay, in terms of attitudes, only one scored the lowest, the willingness to pay. Okay, because it has been promised by the government that the vaccine is it's indeed free. Okay, so we can say that in terms of attitudes, the attitudes in general is quite high. Okay, they're prepared to take the vaccines. They trust the information from government of Malaysia. They trust info from WHO. They believe that vaccines will curb the virus, and they believe that taking vaccines will help them to play to be a responsible citizen to the community. However, in terms of behavior, we see is that the score is a bit lower compared to the attitudes. The highest is searching for information, and then the lowest is to register for their dependents. Okay, dependents means registering their for instance, registering their parents. Okay, so that is the questions. I mean, the objective number 1. We did some very simple statistic to find out if there are significant differences between different group. We found out that there are significant differences of attitudes between male and female respondents. We found out that female respondents has more positive, I mean, good attitudes towards the vaccines as compared to male respondents. No significant differences between sexes in perceived knowledge and behavior. There's a significant differences of perceived knowledge attitudes in behavior between citizen and non-citizen. Citizen has positive perceived knowledge as compared positive perceived knowledge attitude in behavior compared to the non-citizens. And however, there's no significant differences in between KAB between different age group and income group. Okay, so that is objective number 2. Objective number 3 is to find out the proportions of 3 groups of when related to the vaccines. The group who accept, who willingly accept, who are indecisive, and to refuse. So the first 2 pie chart on top of the screen is the study conducted by MOH. Okay, the first one is in December, where the numbers who accept nationally 67%, just 16% who says that they will not take the vaccines. However, the numbers change in April. So because the vaccines are already available in Malaysia, we see 85% nationally says that they will accept the vaccines. Okay, only 5% refuse. However, the numbers is very different, significantly different if we look in Sabah based on 985 respondents. We are only from these numbers, only half indicated that they will accept the vaccines. 27% are indecisive, and 23% says that they will not take the vaccines. So our further analysis shows who are these 3 groups. Okay, the profiles of vaccine acceptance, indecisive, and refusals of vaccine in Sabah. If we look at the simple profilings for those who would like to accept vaccine in Sabah, mostly female, 92% are citizens, mostly the youngest one. Okay, 32% of them are working in the public sectors. Half of them are in the B40 categories, and most in terms of educations, 37 has finished secondary schools. When we look at the profiles of those who refuse vaccines, I don't know why. 53% are male. Half of them are non-citizens. Okay, self-employed, no income, no formal educations, right? And the indecisive, again, females, citizens, private sectors, coming from B40 and secondary schools. So what this data tells us? Okay, we suggest these 7 things to the state health government, Sabah State Health Department. One is additional key messages in the content and development in how the vaccines work, right? We suggest specific key messages for non-citizens to increase their knowledge, attitudes, and behavior inclinations. We also suggest to enhance what we call IPC network to engage Fed sector. IPC is interpersonal communications, and this was taken. So the government, the state government conduct what we call more aggressive outreach program. Okay, increase engagement with private sector employees and students. We suggest that the government take the leading step in promoting vaccine registrations in acceptance, not merely relying on the federal government initiative. Okay, for the non-citizens, we suggest that they employ relevant NGOs, and we also think that women could be the champions in pushing forward the vaccine acceptance programs and interventions. So that's all about my sharing. Thank you very much.
Thank you, Dr. Latif, for sharing the findings of that KAP study. Again, we will reserve your questions for the end of the session. And again, I repeat, if you have any questions that you want to put in the chat box for me to read later, please do so. For now, we will proceed to our third presenter, which is Ms. Regine Diana Endra from Universitas Pendidikan Indonesia, who studies communication studies with a paper entitled Stigma on COVID-19 Survivors, a case study on the other side of the pandemic in Indonesia. So Regine, your presentation, the floor is yours for your presentation.
Okay, thank you, Dr. Anis Azlan. Good afternoon, ladies and gentlemen. I'm Regine Diana Endra. On behalf of Universitas Pendidikan Indonesia, I feel very honored to present our research titled Stigma on COVID-19 Survivors, a case study on the other side of the pandemic in Indonesia. COVID-19 is still one of the biggest problems that every country must deal with, including in Indonesia. Based on world metadata, Indonesia has a total of more than 4 million cases of coronavirus until September 2021. Power 2020 stated that the cases certainly have a big impact on everyone, especially in the psychological and health sectors. Individuals, families, and communities experienced shock, trauma, fear, existential anxiety, and also grief. The COVID-19 pandemic has given rise to stigmatizing behavior that cannot be avoided in society. This serious problem requires serious attention. It is important to understand the different communication strategies of COVID-19 survivors regarding the stigma to build inspiring environments full of positivity, empathy, and establish regulations for authorities. Next, the objective of this research. The first one, the study explores the form of stigma experienced by COVID-19 survivors in Indonesia. The second one, the study digs up information about managing stigma through communication strategies carried out by COVID-19 survivors. And the third, this study finds the use of stigma management communication or SMC model developed by Mason-Beck in 2010. And the methodology, this research used qualitative approach with case study method. According to Sudianto in 2020, case study method explains the detail about an event, program, and activities. The level of activities are at the level of individuals, groups of people, and institutions or organizations to obtain in-depth knowledge of the event. And the data collection was carried out through primary data sources and secondary data. The primary data were obtained from semi-structured interviews with 10 COVID-19 survivors in Indonesia. Meanwhile, the secondary data are obtained through verification to additional sources who are health workers and also scientific evidence from books, articles, or news. And then the results of the data are processed into a transcript, then perform data reduction, which includes meaning, dimensions, and also clusters. And after that, we create a mind map. And then we compile the results and discussions until we drew the conclusion. Sorry. Next, the results or findings. The results shows that the experience of stigmatized COVID-19 survivors in Indonesia took various forms, such as self-stigma, public stigma, health stigma, and also institutional stigma. The 4 stigmas are further classified into 3 forms, namely stereotypes, prejudice, and discrimination. This is in line with Link and Fallon that said that stigma leads to the construction of stereotypes, labeling, and attitudes of rejection, exclusion, and also discrimination. As we can see in the presentation, the COVID-19 survivor in Indonesia, they usually blame themselves because they have COVID-19. And then in the public stigma, the public usually feel the fear and they label the COVID-19 survivor as a dirty person because they can affect other people. And then from the health stigma, the participants experienced is from healthcare attitude or healthcare treatment, because COVID-19 is a new disease. So the healthcare, such as doctors or nurse, they also feel the anxiety or the fear. They feel scared too. And then the institutional, they usually feel like there is a discrimination regulation for them, like they can't go to work or maybe they are fired, like that. And then next, to respond the stigma received by the participants, they carried out several forms of communication strategies. We found that there were 4 forms of strategy which were divided based on self and public. This was conducted from Mason-Beck's stigma communication strategy. And we found there are 5 responses. The first one is accepting. They usually use humor or passive acceptance, and sometimes they display the stigma, they show it, or maybe they isolate themselves. And then there is avoiding, they hide the identity, or maybe they avoid the stigma situations. And then the third is reducing offensiveness. They usually share their experience to other people who have same situation, and then they educate other people for using social media or maybe just share friends, just like a chit chat. And then sometimes they give the explanation why I affected or how can I be affected like that. And then the other strategies are denying and ignoring the stigma. Next, the implications for research or policy. The results of this study provide several implications. The first one, implications for effective communication strategies as the key in managing stigma. The second one, the implications for increasing education related to COVID-19 that the public must know. And the third, the implications for cooperative efforts that must be carried out by the government, health workers, and the community in building public awareness with the principles of openness and empathy. Okay, as the new disease, the spread of COVID-19 causes fear in the community. Researchers found various stigma, such as labeling, prejudice, and discrimination, as a response to COVID-19 survivors. If the stigma lasts for a long time, it will have an impact on increasing COVID-19 cases because people who have symptoms will be afraid to get themselves checked. Therefore, cooperation from all parties is needed, starting from the government, health workers, community leaders, and the community itself. All parties must work together to build public awareness with effective communication strategies based on purpose and empathy. I think that's all from my team. It's been a pleasure to be able to present our research. Thank you for being here today and taking time to patiently listen to what we have to say. Thank you, Ms. Natasha and Dr. Anis Azlan.
All right, thank you, Regine, for sharing the results of your study. I'll now open the floor to more questions, for questions from our participants today. Do any of you have anything to ask our presenters? Anything? Okay, perhaps I can begin. I can start with Dr. Aisa. I hope you're still here.
Yeah, doctor.
Okay. I was just wondering, because your research was an online survey, and it focused for what I presume to be people, who are a little more tech savvy and who use social media in their daily lives. Do you expect any differences in those that are not so savvy, or those who do not have that same kind of access in terms of their needs and their uses and their gratifications? Sorry, Dr. Aisa, you're mute.
So sorry, Dr. Anis, can you repeat that questions again?
Sorry.
Okay.
I just wanted to know if you would expect any differences in users' needs, uses, and gratifications in the communities that you did not manage to reach with this online survey.
Okay, Dr. Anis, you're asking about the differences between the community. Okay, in my opinion, I think this is actually is depend to the demographic factor as well. Okay, I think the education system, I think this is the most important variables that maybe we can study of. Okay, but since this research, actually, this is a purposive sampling, which is this is a purposive sampling. So for this moment, our main target is main focus. Our respondents is the peoples, or these people in Indonesia. Of course, they have their own access to their own smartphone itself. So yeah, this is the purpose of sampling. And then when we talk about the differences between this, maybe the other people, maybe in there's actually this research, there's a few places that we did not cover. As for example, maybe in Kudat, maybe in a rural area, of course. So, but I think there's a differences, and maybe in a few in a future. I mean, in future research, maybe we can look at this demographic factor as well.
All right, thank you, Dr. Isa, for your insight. I encourage those who also have an opinion, or if in your own experience in research, to add on. You can also raise your hand or write it in the chat box to add to the conversation. But I also have a question now for Dr. Latif on the research that was conducted also in Sabah. Your quantitative research was a really big sample, and it was both online and offline. So I was just curious about some of the challenges that your team faced in collecting that data, especially with the offline community. Dr. Latif, you're mute.
Yeah, it's quite difficult. I have to agree, especially for the offline, and moreover, we conducted that survey during the MCO, right? So, but thanks, because we got the funding from UNICEF, so we can hire quite a big numbers of enumerators to work to get the data on the ground. Okay, and we're also very lucky because we have very good connections with some of the NGO, especially when we need to talk with the undocumented peoples, because it's not easy to get them to talk, especially when you talk about vaccines. So we are lucky because we got friends from the NGOs who are working with the group of the undocumented. So yeah, while it gives us the access to the undocumented peoples, okay, but on the other hand, you may also want to question the fairness in selecting the respondents, but that is the only things that we can do. So thanks for bringing this out, because I forgot to put into my presentation, but these are some of the points that we also make a disclaimer to the funders as well as to the state government, because of the restrictions due to the MCO, especially for the offlines. And I also found that when we do online, it's good because we got big data, but the problem is because again, it will be interesting if there are anyone here want to talk or want to take this into to further discuss about the how we call it, the validities of response from the respondents through this online, the convenience of online data collections, because normally what we did is like snowballing sampling, something like that. Okay, we send the link to one WhatsApp group and ask that WhatsApp group to please forward this to your friends. So that is another thing that might affecting the validities of the data that we collect. But since time constraints, we need to get the data as soon as possible. So we need to cover as many as possible. So yeah, that is another challenge that we have to face during the data collections, particularly during the COVID things. Hopefully that answers your question.
Yes, thank you, Dr. Latif. I'm also curious about when you found your findings, the percentage for vaccine acceptance in Sabah was actually lower than the national average. Yeah. Now that people are getting vaccinated, what are the numbers like now? You collected your data back in March, and what's the vaccination rate in Sabah like now?
As of yesterday, still very low. It's 59, 60.
Oh, okay. Yeah. So even though with the not perfect method of data collection, it reflects sort of, you know,
I would like to claim that I would like to claim that it's the data that we collect and the real situations. It's very reflecting our data, our findings. But I don't like to claim that. I don't want to claim that because there are other factors that we need to consider. One is because it's a public secret in Malaysia, because our population's data is very outdated. We relies on the total populations based on the 2010 census. That is number one. And number two, we also have to take into considerations that there's big numbers of Sabahans who migrate.
That's correct.
To the other part of Malaysia. So while I would like to claim, but no.
There are certain limitations that we have to consider with this data.
Yeah.
All right.
Definitely.
Thank you again for answering my questions. Anything from the participants that you would like to add? No? Okay, so I have one last question for Regine. I thought it was very interesting how you studied on a survivor's perspective, and I was just curious about the sample. When you said you conducted qualitative studies, how many were involved, and is this a study that will be taken further, say in a maybe quantitative survey method, or to extend the study?
Okay, thank you, Dr. For the participants, we use criterion sampling. So we decide like the young man and old man, the young woman and old woman, like that. And then for total participants, actually we have like more than 10, but the data is, we think it's enough. It's like, what is that? Data jenuh, like that.
Saturation point, yeah.
Yes, and I think 10 participants is enough, like that. And then for the further research, yeah, maybe we hope that there will be a quantitative research, because the trend, I think it's already changing, because almost 70% Indonesians already have vaccine. So the stigma is maybe decreasing, like that. I think that's all. Thank you.
Thank you, Regine. I also expect that as more and more people get infected with COVID, that the stigma might reduce a little. In the very beginning of the pandemic, when somebody had COVID, we were avoiding them and, really afraid. But a surprising thing that I found recently when I met with a group of students, and one of them asked, how many of you have had COVID? And many of them did, they survived COVID. And it was surprising to me because, in the beginning of the pandemic, that was something that was very stigmatized. But now it's like, yeah, I had it and I'm better now. I'm not infective. So yeah, trends might change as more people get infected as this moves on to an endemic. Yeah, so any other opinions or something to add, comments?
Hi.
Hi.
I would just like to ask, it's kind of related to this issue, but like, I just want to add, like, talking about media does influence us in many ways. Hoaxes or this infodemic can be prevented from advanced social media users. But what about the non-advanced media users? They trust media so much just by the headline without any research. So in your opinion, what do you think is a good initiative to give awareness towards this circle. Thank you.
Right. So I'll open this to our presenters, Dr. Aisa, Dr. Latif, and also Mr. Jean. If you have anything to add on disinformation or misinformation on COVID-19 in the media.
If I can, I will try to respond to that. But I was referring to my another research project. We try to look at whether the level of consumptions, all right, level of consumptions of the media. So we divide the level of consumptions into 3 levels: basic, intermediate, and advanced consumption. Okay, so basically for the basic one is the one who just who received the information for him or for herself only. Okay, so that is very simple definitions. The intermediates is the one who receive and from time to time will share the information to their closest friends or their closest family members. All right, and then those who with advanced consumptions of informations, this we define as someone who receive informations, share it to the others, to as many as possible people, and also at the same time become a creator, creating another using that particular information to create another information, or we call it creating another content based on the information that they receive. So that is advanced. So when we try to make an association between levels of information consumptions with the intentions to behavior change during the pandemic, right? So intentions of behavior change means practicing social distancing, wearing face masks while in public, okay, using hand sanitizers. So we try to make the associations based on the level of information consumptions, and we found that surprisingly, people who are at the basic and intermediate level of information consumptions has demonstrating strong or better relationship with intentions behavior change as compared to people who are at the advanced levels of information consumptions. So that is I pick from my another studies, if that can answer Farzana questions just now. Thank you.
Thank you, Dr. Latif. Dr. Aisa or Regine, do you have anything to add? No? I think the patterns of media consumption, which was advanced users, as Dr. Latif said just now, were more likely to create content and forward on information, but then they were not necessarily more inclined to change their behavior. So there are a lot of talk maybe and not a lot of doing. And I think that also displays some kind of threat to misinformation and disinformation, because these people might be sort of what do you call accelerating misinformation in some senses, but do not necessarily have the practices to back up what they are saying. So that's also something a little bit risky. I'll share as well some of the findings that we found in our research on Malaysians' media usage in looking for COVID-19 information. We found actually that, and I'm sure this has to do with the beginning of the pandemic and how people tend to look for more credible information from more reliable or credible sources. So this was in the beginning, maybe March or April and May in 2020, where we found that a lot of people were actually waiting for the information that was distributed by KKM, the Ministry of Health, by the National Security Council on Telegram, on the official Telegram channels. And they were also looking at some of the more credible sources, such as not social media. It was, the press conferences on TV or what they heard on radio. So this was at the very beginning of the pandemic, where a lot of people were relying on those sources of information for, news or what was new. As we begin to evolve and getting more used to hearing the news off of traditional media, and it's already on social media, you hear conspiracy theories come up, and hidden information, and all of these threats to getting people vaccinated, getting people to socially distance, and wearing a mask and using hand sanitizer. We do find that those are smaller groups of people who are participating in that kind of discourse. But it'd be interesting to do the research now and see where people are getting their information now that everything is, it's becoming the norm to talk about it in all types of media, and not just wait for, the official channels to talk about it. But yeah, that's all I have to share on my end. Is there anyone else who would like to ask questions or share anything about what they have done in research on COVID-19? Thank you for your question, Farzana. Okay, if there's nothing else that anyone would like to add, I'd just like to remind everyone that there is a Best Presenter Award that will be announced tomorrow during the closing ceremony. So I encourage everyone to join in that session. Sorry, no, Thursday on the closing ceremony, not tomorrow. And there will be also a networking session on Thursday, the third day of the conference, where we can talk to each other about possible collaborations, possible networking opportunities with people from different institutions. And even we have some invited from, I think, Google, as well as UNESCO and UNICEF, to talk about what they're doing and how that can align to what your research interests are. So I encourage everyone to join in those sessions as well. Otherwise, thank you very much to our presenters today, Dr. Aisa, Dr. Latif, and also Ms. Regine, for sharing your research findings, and each and every one of the participants here who have taken the time to listen. With that, I will pass the floor back to our MC to close the session. Natasha, over to you.
Okay, Doctor. So, okay, thank you, Chairperson. So with that, we end our parallel workshop session this evening. Before we end the session, thank you to the Chairperson, Dr. Anis, all presenters and participants for this enlightening and fruitful discussion. So please show your appreciation by clicking on the reaction button below. Okay, but before we end the conference session, everyone please open the camera for a photography session. Farhan, can you help me to print screen the, okay.
Okay, let's wait for the participants to open up the camera. Okay, smile everyone. Ready? 1, 2, 3. Wait. Okay, one more. 1, 2, 3. Okay, thank you everyone.
Okay, So hope to see you again in the next Mention conference. Thank you everyone and have a nice day. Thank you, Dr. Anis.
Thank you so much.